Good afternoon, Ms. Peters.
Good afternoon.
We've been talking about breast implants made of silicone. Do you have one with you that you can show to the jury so we understand what we're talking about?
Yes, this is a Celastic 2 mammary prosthesis or breast implant.
Was there someone at Dow Corning who was principally responsible for designing the gel on the inside of that implant?
This implant has the responsive gel, and I was responsible for developing that gel.
Okay. Was there someone at Dow Corning who was responsible for designing the elastomer on the outside of that Celastic implant, Celastic 2 implant?
This is the silicone Celastic 2 implant, and I was responsible for the development of the Celastic 2 envelope.
Okay. Can you describe for us, Ms. Peters, the responsive gel on the inside of that implant? What kind of a gel is it?
This is a silicone gel. It's a cross-linked silicone with a swelling agent. It is a cohesive, soft solid.
Okay. Is it a stable material?
Yes, it is chemically stable.
To the best of your understanding, is that a safe material, Ms. Peters, from your work on the implant?
Yes, my understanding is that this is a safe material.
And with regard to the elastomer on the outside,
Okay, which is this material here.
can you describe that in layman's terms for us? What is that material?
This is it's called an elastomer, but what that means is that it is a rubber. It is a silicone material which has stretch to it. You can pull it, and it retracts just like a rubber band would.
Okay. Based on your experience as a chemist, is that a stable material?
Yes, this is a stable
Objection.
material.
Is it a durable material?
Yes, it is
Objection.
durable.
And to the best of your understanding, is it a safe material?
Objection.
Yes, it is safe.
Do you have a sample of the gel containing that swelling agent with you?
Yes, I do. This is the gel, and it obviously has assumed the shape of the container. That's its viscous component. If I turn it upside down, though, you will see that it is really not pourable, that it is a semi-solid in that it is moving, but it is moving very slowly.
And does that contain the 360 fluid swelling agent?
This has the 360 fluid swelling agent in it, and this is actually the gel 59A that we've been talking to.
Okay.
This is the more responsive gel. This is the gel that was in the envelope that we showed at the beginning of this session.
Okay. Please proceed.
Okay. Another way to measure viscosity or to get a feel for the thickness of materials is to put something in and see how long it takes to drop to the bottom. So if I put paper clips, I'll put a paper clip in the gel first.
Maybe you can turn that. I don't know how well the camera can
I don't know
pick
if
it up.
the camera can pick that up, but actually what's happened is it is sitting on the surface of the gel.
Can you tell us, are silicones used in people for any purpose other than breast implants?
Yes, there are a large array of products.
Can you give us just a few examples of those?
Sure. The elastomer is used for finger joints for correcting arthritic hands and feet.
Do you have a sample of that with you that you can show the jury?
Yeah, I have a model that is used to show the various positions. And this is the various types of finger joints that are used. These are all elastomers. And you can see that it's solid, and they are used, the old joints are taken out, the inflamed joints, and these are slipped in by the surgeon so that the hands now become flexible again so that they can bend. And that uses the attribute of the flexibility of this material. The organic portion, and of course the stability comes from the SIOSI part of the polymer.
What types of patients are those finger joint implants used for?
These are primarily for people who have arthritis, so they would, a large number of them would be senior citizens, but anyone with arthritis, no matter what age, could use them.
Okay. And you're familiar with that from your work in the healthcare business at Dow Corning?
Yes, in fact, this product came out before the Celastic 2, but we built on the high-performance elastomer that was used in this product. We capitalized on that technology to use for the outer envelope, the outer coating of the Celastic 2 envelope.
Okay. Can you give us maybe just one or two other examples of the uses of silicone for medical purposes?
Oops, yeah, put this guy back. There are some rather pedestrian uses. This is a medically related application. Anyone that's taken Melanta has taken silicone. It's called dimethicone. It's on the back of the thing in the ingredients. This is another elastomer. This is a baby bottle nipple. And the reason that these are so attractive is that you can boil these over and over again. If any of you have small children, you know that you boil the nipples, and the typical rubber nipples get gummy and soft and gooey after a while, whereas a silicone, because it can resist high temperature and repeated exposures to high temperatures, gives a better product that's more long-lasting.
Okay. Anything else come to mind?
Yes, this is a hydrocephalus shunt. This is one of the very first products, actually the first product that was used. And this is this goes in the, it's used as a drain to take pressure away from the brain. There's a condition that we used to call, when I was a kid, called water on the brain, but it's really hydrocephalus. And this pump is implanted in the child, and you press these, and it drains the water from the brain to this is a long tube that goes to the tummy area, and then the water is dropped there and then handled by the body to be removed.
How about, are there any tubing or...
There's all kinds of tubing. The tubing that's used for heart-lung machines for open heart surgery is a silicone. That's because it does not clot the blood as much. Another more familiar one that would be this catheter. Again, instead of using for those cases where you have to have a catheter in place for long periods of time, the silicone is much better because it has a smooth surface, which means that the salts from the urine are not going to build up. It also is very pliable and flexible, so it is much more comfortable for the patient. And so
Objection.
this is an indwelling silicone catheter.
Do any of those tests tell us something about the flexibility and strength of silicones?
Yeah, they are very rubbery, and in fact the high-performance elastomer that is used for the outside of the Celastic 2 envelope can be pulled about 10 times its length before it breaks. In other words, if you take an envelope is about this big, you can stretch it 10 times before it would snap.
Okay.
So it's very stretchy during the insertion. That's important to the surgeon.